Is your child repeating words? It feels like the words are stuck in their mouth. It's a bit hard for them to get the words out. You're worried and frustrated and unsure if you should help, because sometimes children and everybody does that, right, while talking. When to help, how to help. Here are 5 tips about stuttering for a parent who's doubtful and who's recently noticed that their child is stuttering. Hi, I'm Priyanka Evangeline, your internet speech language pathologist, and today we are going to talk about disfluencies or stuttering. Firstly, I want to tell you about normal disfluencies that everybody has in their speech. Even now, when I'm talking to you, I might have some disfluencies, and this is very common, up to 10% in a child's overall speech. It's okay to have these disfluencies. They are actually called NNF or normal non-fluencies, and they are okay. But if these moments of stuttering are pretty high, if your child also feels that difficulty, if they are avoiding words because of that, then you need to go for a fluency evaluation and help your child with fluency shaping techniques. Secondly, if you're noticing that your child's disfluency is more than mild, it is pretty consistent and occurring at many parts of their life. It may be even occurring more when they are emotional, like very happy and they want to talk something to you, or if they are afraid or hurt or angry, it might be more. Now, if you're noticing this, one thing to not do is to tell your child talk properly, or no, stop, repeat what you said, don't talk like that. These types of negative feedback on their speech should be avoided. Because I'm going to be very honest with you, nobody knows why people develop stuttering. It's a mystery. There's so many theories, but there is no known reason. But one of the most common threads among all of this is emotional pressure increases stuttering. So we don't want to put more pressure on your child and more negative feelings associated with their speech, because it's going to increase the stuttering. And not to mention, for a school age child, there's a lot of peer pressure also. They want to talk very well among their friends and they want to express themselves freely. So they are already having some pressure on themselves. We don't want to add to that. The third technique is called gentle modeling. So let's take the example of a word like ball. And if your child says, "Mommy, I want the ball," then what you do is you say, "You want the ball? You want the ball?" So what you're doing is you're not telling your child, "Look at me, talk like me, see how I'm talking, see how I'm prolonging the sound." You're not going to do so much direct correction, because remember the second point, we don't want to bring over awareness on their speech. We want them to correct their speech very naturally and casually. So how do you do this is by gentle modeling without asking of your child. Like if they stutter on a word, you are going to repeat that word in a slow, soft manner back to them as you understood and you heard it. You're not going to ask your child to repeat back, because what we are doing is modeling. Through modeling, we are showing them how to talk. And if you get stuck on words like this, see how I'm talking, I'm just being very gentle and relaxed and prolonging the sound. But the thing is with children, they are very independent thinkers and doers. They don't want to be corrected. You must have realized this about your child. With all kids, direct instruction, directly telling them do this, do that, they do it, but they're not really happy about it. They're just doing it because, we are asking them to do it. So you don't want to ask your child to do this. You want to very naturally model for them. And the more you do it, the more they see this way of talking and they try to imitate it by themselves. And the fourth most important technique I'm going to tell you is to go to a speech therapist. Don't try to fix it by yourself, because there are specific speech therapy techniques and strategies to use with your child. There's a hierarchy of teaching, different variations in the stuttering. Like it can occur at certain places, it can occur at certain sounds, in certain situations, in certain emotional context. So a speech therapist is very well equipped to help your child. So go to speech therapy, and one of the most important thing is go to an open door speech therapy, where you can sit inside the session, you can see what techniques they are using, you can ask questions, and you can learn the techniques so that you can also practice with your child at home. And this point is very important because I want you to track your child's speech. So have a small notebook or a notepad, or even in your phone on a Google document, write down the words that your child you noticed, oh, this word is difficult for him, or this sound is difficult for her, or this type of stuttering is more seen in when he talks to this person or in this situation. Note down all the variations in stuttering that you notice with your child. This is going to be very useful for your speech therapist to simulate inside speech therapy, so that even in the most difficult situations they can work on the stuttering and reduce it. Remember my gentle modeling technique. If your child pays attention when you talk to them, or if your child even tries to use them, or they try to repeat after you, give them positive feedback. Remember how I told you no negative feedback? But children thrive and love and grow so well in positive feedback. That is, we focus a lot on what they're not doing or what they're not doing right, and we try to correct them often. But also notice when they do something good, when they use the technique that you showed them, when they repeat it after you, when they try to say it. Say, oh, very nice, you're trying. Yes, you got the sound. You said it so well. So give them positive feedback, not just reinforcement like good job, because that's a very arbitrary thing. Tell them exactly what they did right. That will give your child, oh, this is what I need to strive for. This is what I need to try to talk like. If you've tried these techniques, or if you're still really worried about your child stuttering, or your child stuttering is more than the 10% that I told you, that they are having a moderate degree of stuttering, then you can go to a speech therapist, and you can also come to us for an assessment and for online sessions. You can contact this number on WhatsApp for the same. If you have any questions about your child stuttering, leave it in the comments. I'll always check the comments of the recent video and respond to every one of them. I'll see you in the next video. Bye.